Why share health data with your pediatrician?
Sharing your child's health data with their pediatrician helps ensure accurate, up-to-date care. By providing recent health records, symptoms, and growth milestones, you enable healthcare providers to make better decisions and track your child's progress efficiently. Family health apps make this process easier, letting you collect, organize, and share essential health information securely from your smartphone or tablet.
Choosing the right family health app.
Select a family health app that supports secure data export and sharing features. Popular options include Apple Health, MyChart, and other apps recommended by your healthcare provider. Look for apps that let you manage multiple family members, store immunization records, track medications, and export data in formats like PDF or CSV for easy sharing.
Exporting your child's health data.
To export health records, navigate to your app's data or sharing section. Locate your child's profile, then select the option to export or download health information. You might be able to choose specific records like immunizations, growth charts, or doctor's notes. Most apps offer downloadable files or direct report generation for sharing with healthcare professionals.
Sharing data secured and privately.
When sharing sensitive health data, always prioritize security and privacy. Use in-app secure message features, encrypted email, or your healthcare portal if available. Never share health reports on social media or through unprotected channels. Confirm your pediatrician's preferred way to receive electronic health records to keep your child's information protected.
Tips for effective communication with your pediatrician.
Inform your pediatrician before sending digital records. Attach a brief note explaining which data you're sharing and why it's relevant to your child's care. Keep records organized and up to date in your app for future visits. Consistent, secure sharing helps your pediatrician provide the best care possible for your child.